With Carrie Kaplan from Men to Men Physical Therapy here, and so nice to be with you again. Today we're going to learn about something that's really important. Last week we talked about trying to understand why the diaphragm the attachment was smaller on the left side than on the right side. And so I asked a question, and I hope that people had a chance to creatively experience what the answer could be. And I'm going to put a couple things out there because everything is really just a guess or just a theory at this point. So the diaphragm, and we're going to be talking about the diaphragm today. We're going to talk about how all the diaphragms, the trunk diaphragms or the axial diaphragms from the pelvis to the mid-skull, how much they all help all our functions to work so well, whether it's your internal organs, your brain, your spinal cord or spine, or all the appendicular structures, meaning our arms and legs, okay? And so we're going to learn about those things, but we're going to talk about first the main diaphragm. And last week I threw out the question, why is the left diaphragm, the tendon that connects into the spine, why is it only on L1 to L2 on the left side and from L1 to L3 on the right side? And so when we see pictures, MRIs or X-rays at this point, it appears that the left one is smaller. And my theory is because we are under so much stress with our modern living that we have a tendency to breathe more through our right nostril than our left nostril. And so maybe the whole left side of our body is actually not getting the pressure changes that it really needs to work very well for all our systems to work in harmony and in health. And so, and maybe it's just strength a little bit. The other possibilities is because the bottom back of the heart, 2/3 of it is directly attached to the left side of the diaphragm. Maybe it needs a more shorter reinforcement to keep its pulling, its strong force. Maybe if that tendon was too long, it would make the heart maybe just too loose a little bit. And the heart is a very strong, soft and strong organ, which is so beautiful that it has both those qualities. And obviously, as beings, we want to also have that softness and that strength at the same time. Very similar to what the heart is shaped and its function is. All right, so we're going to go through why is it important to have 5 different diaphragms in the body? What are the 5 different diaphragms of the body? How do we get them to turn on? How do we get the left side and the right side of the diaphragms to engage and not just be right side? What can we do to make a shift in our minds and in our bodies to kind of have a more balanced diaphragm engagement? And we're going to talk about the diaphragm's attachments to some very important structures in our bodies as well. So let's start with what is a diaphragm? Okay, a diaphragm is, if you can imagine, a parachute that kind of goes a little bit up as you is it kind of floating, and then when it pushes down, it spreads out really wide. It doesn't just spread out in one direction, it spreads out very wide, right? And that motion of that shrinking and lifting like almost like a cup and then spreading out wide changes the pressures in the body. We have different cavities in the body. We have one, the pelvis. We have the abdominal cavity, we have the thoracic cavity, we have the neck cavity, and we have the skull cavity, right? And so all these structures are very important for changing the pressures so the circulatory system can quickly or very efficiently help the heart to get all the blood vessels to move back and forth to itself, to the heart, right? So the heart put in these beautiful diaphragms. All right, so we're going to start with the main diaphragm, which we already touched upon, right? Because we talked about how the left tendon that connects to the spine of the diaphragm is a little bit shorter than the right side. So the diaphragm, the main diaphragm, goes all the way around your body to these floating ribs right in the back. And so when we are standing back on our heels, we don't really push that diaphragm down. It kind of just barely moves. And so when we want our organs to be healthy, we have to stand forward and a little bit on the inside of our feet and spread the feet out. The palms of the hands, the palms or the plantar fascia of the feet are also, I consider, diaphragms, right? And so you want to feel them spread out, especially on the inhale, and on the exhale, you release them. Again, I'm forward. My butt is relaxed, right? So my pelvic diaphragm can open and close efficiently, all right? So now we're talking about the main diaphragm of the body, the thoracic diaphragm, and we're going to start talking about this. So this is the main diaphragm, and when you inhale, it spreads down open in the back, all the way down. Remember, if you're on your heels, then it only goes forward. And when it spreads down and opens, the inferior vena cava, which gets all the blood vessels all the way up from the legs and the abdomen, goes back up into the heart, right? It goes through the tendon of the diaphragm. The other structures that go through the tendon of the diaphragm is the esophagus, which goes into the stomach, and the vagus nerve that gets all the digestive muscles, because you have muscles in your digestive system that make everything work. It goes through that hole in the diaphragm. And the inferior vena cava that goes right into the liver, or feeds the liver, and then all the way down to the rest of the body, down into the inferior vena cava, it ends at below the belly button, that goes through the diaphragm as well. The aorta, which is the main blood vessel that goes from the heart, that goes right behind the thoracic diaphragm. So when we're standing back on our heels, it doesn't get a good squeeze and a good opening. So that's why being a little forward, a little bit on the inside of the feet will really help your blood vessels and your diaphragms to engage. And you can even try it. So let's all stand on our heels, tuck our butt underneath, kind of maybe drop our chin and take a deep breath in. Almost impossible, right? You're like, wow, that's really hard to breathe. Now let's all come forward, stand a little bit on the inside of the feet, feel this lift in the spine, the openness in the chest, and do a deep breath down and feel that back spread out, almost like a gorilla breath. Easy peasy to take that big expansive breath. And when you do that big expansive breath and your butt is relaxed, the bottom of the pelvis is where the other diaphragm is. And some of the diaphragm is lots of different muscles of the pelvic floor, and they include the muscles that when we're sitting all day or when we're tucking our butt, they kind of clench. Remember, the muscles have to move open and they have to go close. They can't just stay squeezed or open. They have to do both. Big expansion, and then the exhale, they release. Okay? So the pelvic diaphragm, right, the base of the pelvis, and we're going to go through exercises for them in the future in just a short while. The pelvic diaphragm goes with the abdominal diaphragm. So when you inhale and you spread open that abdominal or the thoracic diaphragm, so does the pelvis open up. And we're so afraid to allow that space to open up. We're so used to clenching it closed, right? So just see what it feels like to open it and close it. Then you're really learning how to use those muscles to help our bladder function, our sexual function, our digestive function, right? So that's just to name a few of the things, or even the sciatic nerve, right? When we're squeezing the pelvic floor, we create kind of a very contracted force on a lot of our nerves and organs in our pelvis. So we're talking about two diaphragms, and we're going to go up to the diaphragm that's in the shoulders, the tops of the shoulders, right? And we do a lot of breathing into our shoulders. Sometimes we don't breathe here, sometimes we don't breathe down here, and so we do a lot of breathing up in here. And sometimes if we're really stressed, it's only on the right side. So a lot of right shoulder and neck issues have to do with the fact that we're not breathing from any other place. And we'll discuss why it's so important to breathe in so many places for all the pressure changes in the body in just a moment. The next diaphragm is right underneath the skull, including the bottom of the chin. So if we're looking down at the phone, down at the computer, or just kind of in a posture like this, we kind of not allow that diaphragm to open and close. When we don't open up our nose to breathe, when we don't smile in our face, when we don't move our tongue, when we don't do that, we don't engage the base of the throat and the neck. We don't allow our blood vessels to go to the brain. We don't let the nerves go from our brain to our body, right? And so all kinds of havoc occurs from not opening up this very important diaphragm. And again, it flattens out on the inhale. The last diaphragm that we have is right in the kind of the mid-skull area. You'll feel a bump in the back of your head. That's the back of the diaphragm. And it goes right through the space between the nose and eyes, all the way here. And a lot of our sensory function happens because of this opening and closing of the diaphragm, along with our hearing, along with our ability to concentrate, to have focus, to be motivated, to let go of our fears, to see or to interpret sight, to be able to sleep well, to have hormonal balance. So having this diaphragm up here move is vital for our bodies. Not only that, it kind of covers where the cerebral